to screen for alcohol, alcohol use disorder identification test. 5 areas I'll touch. Why you should do it? It's a proactive healthcare approach. So, spectrum of alcohol use disorder and AUDIT, that is your screening test. How AUDIT helps in intervention and conclusion. So, as you all know, for all non-communicable diseases, there is a shift from approach from episodic reactive to continuous proactive. So often in our setting, in a healthcare setting, people present at the end of the problem, and some person present with cardiac event or myocardial infarction, instead of taking care of the early part of the problem, that is healthy living habits. Similarly, we all of us in list here, we are sitting and we see the last end of the illness, that is addiction, rather than looking at the early part of the things. We all know that a proactive healthcare need to look at the continuous and proactive screening methods where you can identify and provide adequate care for the person. I'll start with a very interesting case which actually I saw yesterday OPD, and one of my residents brought this case to me. See, Mr. AMAR, I've changed the name actually. He's a 25-year-old student, has been sent to me from neurosurgery emergency after getting treatment for a fall and injury. There are a couple of injury marks on his face. He was found drunk a couple of times in class, got into brawl in the weekends, and also reports that he drinks socially probably twice a week or once or twice a week because a friend forced him. Normally, friend forces him. His study performance is going down and has a couple of blackouts. He doesn't remember what happened last evening or night, and there are recent injury marks in the face. So this is a scenario where the person was being referred from neurosurgery OPD to us. And as I mentioned, he tells that he takes only once or twice a week alcohol. So coming to the proactive approach in alcohol use disorder, self-recognition and early identification of alcohol use disorder is often ignored. Only when well-established alcohol dependence or addiction who has multiple problems like physical, neurocognitive, psychiatric complications, they only land in the treatment centers or they basically consult. Often the health professionals believe that persons with alcohol problem cannot be helped unless he hits the rock bottom. It's like unless you're addicted, you just cannot do anything. And this unfortunately health professionals believe. And you must have heard GPs telling patients, you drink less. You drink less, don't stop. You drink less. Less drinking is good for health. I mean, all of us know about this. That there is a misconception that you need to be addicted to get treated or to take help. If you look at the evaluation of conceptualization of addiction, and currently, as I told, patient or family members come to us for patients who are alcohol dependent or addicted, which is a psychobiological syndrome, where you have, core feature is a salience, that is alcohol becomes center stage of a person's life, as you know, alcohol addiction. And neural circuits that reward response inhibition, salience are the major circuits which are completely hijacked and reformed. And brain areas, if you can see the right side, ventral tegmental areas, nucleus accumbens, prefrontal cortex. So all these brain areas are completely reformed or hijacked by the drugs. So when you see a person addicted, he's already gone through very serious changes, which obviously you don't know how much you can do in that. So look at the spectrum of alcohol usage. You can see a majority people are abstinent. They don't drink at all. Then concept of self-drinking. Then we have a risky or hazardous drinking, harmful drinking, and dependence or alcoholism, the tip. So the severity increases as you go from the down to bottom. So that you can see the point I'm highlighting here is that the persons what we see in our practice in this hospital are the top end with severe problem. But then you have, before a person reaches the yellow top, he has to pass through a couple of other steps. So our job is to identify them in those steps so that you can help them better. If you look at WHO, how is defined all these parameters with hazardous drinking, where level of alcohol consumption or a pattern of drinking that is likely to result in harm. So now is all right, but if you continue like this, he is likely to get harm. Harmful drinking, pattern of drinking which causes harm to be psychological or physical, and obviously addiction, which is a symptoms of withdrawal, tolerance, craving. These are the WHO types. Now, just coming to something known as low-risk drinking or safe drinking. Now, again, remember this concept I have taken from is mainly from abroad, where alcohol drinking has been a part and parcel of normal living. Hence, you should. I don't think in Indian context there's something only low-risk drinking has been defined. So this is from NIAAA. I've taken. So if you look at the what is low-risk drinking, you can see. I will talk about the men. For a person or a man, there should not be not more than 4 drinks a day. Now remember, you're talking about 4 drinks in 45 ml spirits. This US standard. So basically 1/4. It comes around 1/4 of drink per day. Should not be more than 1/4 of drink per day. And if you take whole week, it should not be more than 14 drinks per week. Obviously, in case of women, it is much lesser. As you know, women are more vulnerable for substance-related hazards. So definitely, it's much more less. But again, these are the. So if you want to keep yourself low risk, you take both the parameters. It should not that you take only 14 and you take, let's say, 2 per day, and 2 into 7, 14, and 2 into 7 is 14. No, it doesn't make any sense. So you have to both single day and weekly limits, both you have to keep together. Remember, I mentioned you, it's 45 ml per spirit. So basically, that's how the US measurement. So this is known as some so-called safe drinking or low-risk drinking. Now, in our context, we don't have that type of norms or to decide, but definitely this is how what other developed countries uses. Now let's look at a very interesting. This is again from NIAAA data. Look at if heavy drinking is defined as more than 4 drinks per day or 14 per week. A person takes 1 heavy drink a month. So in 30 days, he takes only once, but he takes more than a quarter or 4 drinks. Now, what is the risk of addiction? 2 out of 10. So you can see red chart, red graphs. 2 out of 10 can get into addiction if they continue like this. Second option, a week. 1 heavy drink a week. So more than 4 drinks a week. So 3 out of 10 get into addiction. Now coming to the third group, which is much higher group, where you take 2 or more heavy drinking days a week. So twice a week you drink heavily. Heavily means more than 1/4. The chance becomes 50%. So 5 out of 10 are likely to get addicted if pattern goes like this. So this is the NIAAA data about thing, which again worries you a lot that you need to be careful and tell the people not to reach this level. So hence you need to screen. So you need to screen to find out how much they're drinking if they're drinking, because you don't want people to get addicted. You don't want people to get dependent. So if I can take an analogy, screening of alcohol is similar to what you do for hypertension, what you do for hyperlipidemia. Probably you do for hypertension and hyperlipidemia a little later, but now if you look at the latest guidelines, that tell hyperlipidemia you should screen at age 20 onwards. So obviously much earlier than what used to be believed. Its objective is early detection and treatment of developmental stage, prevent established disorder. Now there are multiple instruments in the past also, like CAGE and Michigan addiction alcohol screening test, but unfortunately they have not been used in multiple cultures and not been tested so vigorously than the AUDIT has been. So in that context, I will introduce you to the AUDIT alcohol use disorder identification test. I am sure most of you may have used AUDIT screen. It's a free, downloadable. I'm very sure, but I still think it's good to use it and as objective measure in your own practice. If you look at why AUDIT is so popular, you look at it's a part of WHO 6-country collaborative study. They came with 150 questions when they did the study, and they come with only 10 questions which has greatest discriminatory value between hazardous drinking and non-drinking. So it's been tested, it's been used by multiple centers, and now after this, a lot of articles, lot of literature has come out. I'm just not going to details of all these things you'll get in the website. If you look at the scale, I'll just come back to scale and tell you how to start it. Now, first important point we're starting, you have to follow the starting age it's been drafted. Like I'm going to ask you some questions about your use of alcohol beverage during the past year. Now, this can be used if you're specifically asking for alcohol. Now, you're not asking for alcohol, but checking about lifestyle. Then you can tell as a part of our health checkup, and lifestyle checkup, I want to ask some more question about your alcohol use. So you can tune it where you want to use, which setting you want to use. You are using a let's say college setting, or you're using a counseling setting, or using a outdoor setting. So any setting you can tune it around. Use this scale when person is not intoxicated, not withdrawal, or basically medically, physically stable. All right. You can use in OPD, general setting, person, workplace intervention. You can need, somebody working in railways or somebody working in bigger agencies. You can use this scale. Ask the question as it is in same order. So that's very important. And the most important point to learn before you start the question is what is 1 unit of alcohol. I know most of you know it. So 1 unit of alcohol is 30 ml of spirit. You can see other details here. So you should be clear about 1 unit of alcohol, because most of these questions are based on the unit of alcohol. Yeah, probably beer. In India, we have 2 varieties of beer. So standard beer, a strong beer. Unlike abroad, we have a single beer. So you can look at beer concentration. Because the reason is in India, unit is very, very, very variable. And most people in my OPD, they tell 1 unit is 60 ml. Because 60 ml pouches are pretty popular, and I don't think 30 ml hardly people tell, at least those who are people who see. And but is 30 ml. So coming to the first 3 questions, the reason I'm taking the question by that is there is some significance to that. First question is, how often do you drink containing alcohol in last 1 year? So everything in last 1 year. So 0 means 0 is scoring. 0, 1, 2, 3, 4 are the scoring marks. So never, monthly, and so on. How many units of alcohol do you drink on a typical day when you're drinking? How often do you have 6 or more units of alcohol on one occasion? Again, in last 1 year. So why is important? Because of these 3 questions. Now these 3 questions picks up hazardous alcohol use. First is frequency of drinking. Second is typical quantity. And third is frequency of drinking. So anybody scores any points in this, he is taking alcohol hazardously. I have defined hazardous before. Hazardous means if person continue to drink like this, is going to land up in a much serious problem in the future. So these 3 questions tells about hazardous drinking. Next 4, 5, 6. First question is, how often during last year have you found that you are not able to stop drinking once you started? Again, scoring pattern is there. How often during last year have you failed to do what is normally expected from you? And you need a first drink in the morning. I think these questions are very self-explanatory. I'm sure you must have guessed what I'm trying to pick up. It picks up dependence. These 3 questions picks up dependence. First is impaired control. Second is increased salience. Third is morning drinking. So these 3 questions picks up the dependence or severity of addiction. Coming to last set of questions, 7, 8, 9, 10. First is about guilt. Do you have a guilt anytime in last 1 year? How often you are not able to remember? There is blackout. You are not able to remember what you have done last night after drink. And 9 and 10 are very important. Look at the scoring pattern of 9 and 10. You don't have 1 or 3. 0, 2, 4. Unlike all 1 to 8 questions, 0, 1, 2, 3, 4 as scoring. Here it is 0, 2, 4. So it means this question has significant meaning to it. Have you, someone has been injured because of the alcohol drinking, or any friend or doctor has told you to stop? So those questions are very important, 9 and 10, because of the significance. And if you come back to this tells about harmful alcohol use, guilt, blackout, injuries, and consent. 9 and 10 I mentioned, higher scoring. So if you look at this score and look at what you're going to do now, you got the scoring. Now 8 to 15, you have go for simple advice, can give a booklet of self-help. 16 to 19 score, go for brief counseling or monitoring. Now more than 19, I think he needs a specialized group like all of us. Most of us are working in specialty, or somebody who has got higher training in alcohol and need to further go for investigation and dependence. Now what happened less than 8? Now interesting scenario. Let's say somebody has been drinking alcohol in past, and last 2 years he has been not drinking. So his skill score less than 8. Correct. So because you're taking last 1 year. So one important point to remember, you need to educate him. Tell that, yeah, you need not to start again. You will going to hook it to again further. And those are not drinking, well and fine, continue the same habit. Now this question I spoke to it, and very interestingly, I applied the audit in that question. The patient who I spoke yesterday, my resident got to me. So resident told me, sir, he is social drinking, harmful drinking. I don't think there is any dependence to this. There's no much severe problem. Because if fall down, some marks are there, and neurosurgery sent to us. Then I told, let's use audit. I will tell how I used audit at the end, because obviously I'm not carrying a scale. I will tell how I used. I did audit score and I found it 26. So I got 26. So if you go back to your first thing, now look at where he is false. So obviously it needs further investigation, further exploration, specifically asking about withdrawal tolerance, craving, salience. So then obviously we went back and obviously my resident again asked, and you found out when you ask alone to the person, then you get further information. See, the point I'm telling is that this is being objective thing. It definitely helps you to go beyond what you do it. Particularly the cases where you have a little doubt, like again, we normally see the case for dependent, but definitely you can use it for your practice. Now, how it helps me, when I get a score, I show to the person and I tell, see, this is 26. It means you need something like this, which means you need a further intervention, you need investigation, and you need more intense treatment. So that's how I use it in my practice. Now, use of audit for intervention. Audit is the first step for engagement and process helping. So, audit is not just a screening. It is just an engagement with the client who is completely denial or is minimizing the problem. When you come with specific question, asking very specifically, often you get more information. And it helps in finding out appropriate intervention, as I mentioned. You can link to brief intervention, which is very low intensity and short duration. And it can be as less as 5 minutes. Just have to give 5 minutes of intervention and you can do some justice to the thing. I will just two slides I will speak about frames. I know most of you know it, because the brief intervention that is linked to the audit score is on frames. So you can see the things. So feedback is personalized feedback, responsibility, advice, menu, empathy, and self-efficacy. You go a little further, you can see feedback is based on the level of substance use, harmful effect, and client motivation to change. The client which I saw yesterday, I did tell him after the scoring, I told, see, this is how you are being placed here, and what do you think about your challenges? Then you discuss about some of the feedback I gave to him. And I also told him it's your responsibility to control things and keep the things under control. And obviously advise very clearly and explicitly, no ambiguity. Often people advise, take a little less, don't take so much, which is basically ambiguous advice. You should never ever give ambiguous advice. Menu, some sort of option. Can you handle things differently? Keep a diary, found relapsed recipients, reading a pamphlet, or attending some counseling sessions if possible. Empathy, very important and very critical to the treatment of particularly harmful drinking. Some listening and understanding the approach and understanding the reason behind why is happening, and self-efficacy that you can do it. So briefly I spoke. Now, for example, you are running short of time and you have very less time to, you're running a busy practice, you have very less time. Use this audit C. Audit C, it uses only 3 items. First 3 items audit C, and somebody scores more than 4 when hazardous use is established. So if we are having, again, 0, 1, 2, 3 are the scoring, 0, 1, 2, 3, 4 are the scoring. More than 4, he has hazardous use, and obviously 7 to 10 is dependent. So again, if you are running short of time, audit C is very useful. Okay, I will leave in a very informative talk to you. This is audit Android. As you know, most of us now are smartphone-based thing, and this helped me yesterday because I don't have audit copy with me. So I use audit Android, and you can download it free in Android Google Play. So it has completely same. It follows the thing, and at the end it gives you score. You score, okay. For let's 24, you do this, like this score is there, and also there is a audit online version been developed by University of California. It's there for their place, but again it has been experimented in some of the studies now where people could, but that is not freely in sense. You probably may need license. But Audit Android is free app. You can download from the thing. I think, as you know, Dr. Jairam Srinivasan, who is a psychiatrist at US, has developed this Android and is in the free in the store. Right. So you can use Audit Android and make a habit of using all the people who comes to your practice to have audit. And audit can be reapplied after a year. So there is a chance of reapplying and follow up. Like after a year, you can again apply audit. Let me wrap it. I promise I will not take more than 20 minutes. Take home message. This gives you opportunity for screening, early detection, and brief intervention. Irrespective of the setting, where are you working? Be it a workplace, be it a college, be it a school, be it anywhere you're working, you can use audit. I've given you Android. I mean, I'm not given, somebody has done Android. So you can use Android, not remember the scale completely. And if you have time, short time, use the first 3 components of audit is good enough. And it's very easy and culturally appropriate. I mean, if you look at the literature, audit has been used in India, and All India Institute had actually done a study about audit and brief intervention and published a paper a couple of years back. So there's no issue about the cultural appropriateness of audit, which is a good part of that. Yeah, I think, I mean, this is a free downloadable audit. It's been there in the net, Babur's paper. I think I'll stop here. I finished. Yeah. So